model shows thousands of lives could have been saved if the country had taken steps earlier to lock down. It's an article in the New York Times.
Dr. Zorba Paster is back with us to discuss this and other pandemic headlines. Good to see you again, Zorba.
Good to see you guys.
So the issue is here we didn't separate soon enough.
Right, and that really is the issue. So these are statisticians out of several universities put together essentially research looking at what would have happened had we actually socially distanced sooner. In other words, separated sooner. And their estimation is that if we had done it, especially in the major cities where the outbreak had occurred, if we had sort of followed the Washington state model in New York City, in New Orleans, in Chicago, where a lot of this occurs, that we would have stayed somewhere between 36,000 and 50 to 60,000 lives. I mean, it's really sort of amazing information that's coming out. If we look at Washington state, where a lot of this really sort of the first time we really recognized we had an epidemic, and we had followed what the governor did there in these other cities, it would have really made a difference. And I think the important thing going forward from this is we realize that social distancing is still important. And even though we're opening things up and we're beginning to get together with people, we still have to look at how close we really are. And once a number of counties opened up in Wisconsin, and I looked at that bar in Platteville that opened up and saw people going together in the bar, hugging each other, getting next to one another, I thought to myself, this is not really the way we want to open up. We want to open up correctly, slowly, open our circle of friends and family, and then really go from there. But it shows the importance of social distancing because this is a silent enemy. It is a silent virus. It's the true terrorist of our time.
A lot of states that did open early are seeing a rise in cases now.
Right. And we've got to attend to that and then figure out where's the rise, what are we going to do, how are we going to actually do this appropriately, how are we going to get our haircuts and get our haircut not spread it. And we've got, Penny and I have 4 kids. One of our kids lives in Verona. And he made a comment. He said, I don't want to come into your house. I don't want to bring death into your house. And when he said that, it sort of struck me. And all of a sudden I realized he's not just doing it for himself. He's doing it for us because he wants to keep us safe. The older you are, the greater the risk you have. And that's the important thing to realize.
And wearing a mask is more for the other person than yourself.
It's more for the other person, and it's really good hygiene. You know, your mom told you after you're in the washroom, wash your hands. That's the appropriate thing to do. Wear a mask is not a left-leaning issue, a right-leaning issue. It's not a Democrat or Republican issue. It's really protecting all of us, and it's a sign of good hygiene because we don't know who has it, and we want to keep that from spreading to others. And because you don't know if you have it, you've got to make sure you wear a mask. No matter where you go, wear a mask outside. Be a good citizen.
All right, Zorba is going to stand by. We're going to be taking your calls for Dr. Paster in the next segment. If you have a question, the number is 270-9933. So call now, and we'll take your calls in just a little bit. We'll be right back.